Assalamualaikum doctors. In this video, I am discussing a recall development that come recent, just few days back, 2024 in Nepal, Duchenne muscular dystrophy development. So first of all, as usual, we know that some concern about development or working concern, mother will tell us. Then we can take the history. So first of all, I'm really sorry hearing about that. Onset, course and durations, anything make it better, anything make it worse. Then how, when, what you did. So when she noticed first, that we ask. Then about the any skills that he has acquired then lost. First of all, it is a boy because Duchenne is X-linked recessive disorder. Then any behavioral abnormality, describe his daily routine, any chronic illness present or not. So chronic illness, maybe they tell that she has respiratory tract infections, cardiac infections, or he has low immunity, frequent any infections because DMD are associated with that. Or any concern, any other concern, here also mention something, or he can tell that his calf muscle is swelling, or any other concern, he is frequently falling. Then these are head size, we ask, then identify the cause, any head trauma, any fits or abnormal movement, then any infection in the brain, any ear infection repeated, skin changes or change color. What about his hearing, any problem in hearing, any problem in vision. Sometimes they have speech problem in Duchenne muscular dystrophy. How he look like, and is there any swelling any part of the body in front of neck for thyroid and any part of the body, because if there is come as a walking concern, we ask that any swelling in any part of the body like behind the leg or about the calf muscles. So for Duchenne muscular dystrophy, I am smallly telling that some important point. First of all, it is X-linked recessive disorder. So male child, concern walking pattern, that funny walking, excessive walking, or pregnant women like walking. When we tell they describe his walking, then he has frequent fall history, weak muscles, heart problems can be, racing heartbeat we can find. So systemic review we can ask, respiratory infections, repeated bug, then speech and social can be delay, upper limb and lower limb age difference can be. So there is upper limb and lower limb age discrepancy can be present. Then swelling of the calf muscle or behind the leg. In unit we ask about the heel prick test. It is very important because that is walking issue. So heel prick test we are asking. Then family history positive or not. Is family history is positive, maybe his siblings or died, or mother brother, especially his maternal uncle is wheel bound or death. So these are the point we keep in our mind if we catch the Duchenne muscular dystrophy. Okay, so then as usual we are asking about the birth history. Birth history is that mother age, we know, mother taking any drugs or illegal drugs. These are routine questions we ask in development. Mother has any disease. After birth, he cry or not, any admission needed. Describe his birth, like preterm or term. How about birth weight? And especially the heel prick test is very, very important. Heel prick test and hip screening, any hip screening done. Because DDH is one of the DD, walking problem, rickets, DDH, then also the Duchenne muscular dystrophy. These are we search in walking problem. Postnatal, any NIQ admissions or not, any birthmark or skin pigmentations. Past history, any treatment he is taking, any team he is following. Maybe he is taking team following, like physiotherapist following, occupational therapist following. Any previous investigation done or not, previous operation is very important because they have muscle weakness. So maybe anesthesia problem, previous admission we ask. Other domain means, suppose our case normally they give gross motor, in Nepal it come gross motor assessment. So we on the history we ask about the fine motor and the social and speech. So first we can for fine motor we can ask, like I have given him crayon, what he draw. By that we can ask, and if he cube I give, how can he make that, can he able to make the tower. Okay, that is we can ask. From the social, what we ask, social we can ask, how can he feed himself, he's working using knife, fork, anything. And what about his toilet trained or not, or can he indicate his need, like that we ask. Speech, both expressive and receptive we need to know. So how many words he use in sentences, can he according to age, can he tell a story, can he sing a song. If 3 years age, so can he sing a song. Then story, 4 years of age we ask. Then also the order, how many order he can do. By that receptive we will do. These 3 domain we ask in development. Then as usual we are going to the birth history. We ask domain development. Then social is very important. How many member in the family, family history of similar condition, it is very very important. We know maternal uncle can be, even sibling can be die, another boy. Any blood relation mother and father has, then how, if a speech delay, how many language we ask. Then what you do for living, is it income is satisfying, what about his school. Then how about his school, he is any bullying issue in the school, he is going to the normal school or mainstream school. School perform any home modification done, it is important here, any home modifications done for him or not, as he has walking problem. So these are the in DMD history. And suppose is telling that do the gross motor examination. So we know normally gross motor come in Duchenne muscular dystrophy, and it comes on the 2024 in Nepal. So gross motor, first of all we ask walking, can you describe me how can he walk? Can he front walk 1 year, then back walk 1.5 year, side by side 3 year, then tandem walk, front is 4 year and back is 5 year. Of course we ask about the gait, how about his gait. Then standing, can he standing like tiptoe standing 2 year, walking tiptoe 3 year, and run 4 year. Then standing with 1 second 3 year, 1 leg, standing 1 leg 1 second 3 year, 5 second 4 year, and 10 second 5 year. Running we will ask, can he run stiffly run 2 year and smoothly run 3 year. Then we go the jumping is 2 feet in place 2 year and forward 3 year. Then 1 feet is hopping, in place 4 year and forward 5 year, and also 5 year he can do the skipping. Then also I ask about the ball is very very important, because we need to differentiate between the upper limb and lower limb. Maybe lower limb and upper limb age is different, so lower limb we ask by stair and his walking pattern, upper limb by ball. If I give him a ball, how can he kick first? So standing kicking 2 year and running kicking 4 year. So how he catch, very important, outstretched hand is 3 year, above the head is 4 year, and catch is 5 year, chest is 5 year. So 3, 4, 5 years, that is outstretched hand 3 year, above the head 4 year, and chest is 5 year. Then throw, how can he throw ball? Outstretched hand 2 year and above the head 2.5 year. Then we are going to the stair. First of all, how can he walk, like child manner or adult manner? We know child manner is 2 step in one place, and adult manner is 1 by 1, like we do. So that is we do child manner both up and down 2 year, adult manner up and child manner down is 3 year, and both adult 4 year. Bicycle we ask, tricycle he ride a 3 year, and bicycle by 7 year. Then also we ask he tricycle is doing only pedal or go forward, because he has muscle weakness, we will ask that. And that at the last milestone we are asking, first of all milestone is that 12-month-old walk first step, stand up from the lying positions. 9 month is sitting unsupported and crawling and pull to stand. So sitting unsupported, crawling and pull to stand. 6 months sitting supported. 3 months full head support. 6 weeks turn head one side and partial head support. So this is about gross motor in Duchenne muscular dystrophy. And management, if come, they will ask that after development, how can you manage? So manage as usual, some few lines we know, that is I will other domain, then other domain essays, child developmental central SAND, hearing, visions. I will run some test. What is the test? Mainly it is an X-linked recessive disorder. So genetic testing is the X-linked recessive dystrophin gene. Remember dystrophin gene and CPK creatine phosphokinase, which is very high by 1000. ECG echo you can do, X-ray of the spine, pulmonary function test, and ECG geometry. And multidisciplinary team I will involve, that is neurologist, cardiologist, physiotherapy, occupational, pulmonology, genetics, social, psychological support to the child. So neurology, cardiology, respiratory, occupational therapy, physiotherapy, psychological support to the family, genetic counseling, as it is an X-linked recessive, so mainly dystrophin gene. So this is all about DMD history. Remember, when you take the DMD history, upper limb and lower limb. Upper limb by ball, that if I give him ball, how he catch? Outstretched hand, above head or below head. And lower limb by stair walking, we keep in our mind that when we take this history, this is the differentiating point we need to identify. So outstretched hand 3 year, above the head 4 year, and at chest 5 year. This is all about DMD development history. Thank you.